The questions which we are going to discuss are frequently asked questions. So these questions are like important questions. So you have to read the question and then try to select the answers. Okay, so rather than noting down. So the first question, 62-year-old man is diagnosed with a localized non-cell tumor of lung without metastasis and under lobectomy. After the procedure, he brought to postoperative anesthesia care unit for recovery with chest tube drainage system in place and administered by oxygen through nasal cannula. Okay, there is a typing error. And which nursing action is initially most important? Assess level of consciousness, attach chest tube to bed sheet, perform deep breathing and coughing, apply elastic stockings to leg. So what is the situation here? 62-year-old patient diagnosed with a lung cancer without metastasis. That can be the reason why underwent lobectomy. So after lobectomy, where is the patient now? At post-operative anesthesia care unit for recovery. That means the patient is not completely recovered. Okay, and there is a chest tube drainage system in place and oxygen. Okay, so the patient is on oxygen and the chest tube drainage is in place. And which nursing action is initially most important? See, the key of the question is always in the last. Which nursing action is initially is the keyword here, initially most important. Clear? So all these four options are important, but you have to select initial or a first action. What is the current situation of the patient? After surgery, the patient is being transferred to a recovery unit and the patient is not completely recovered. Okay, so you can just remove wrong answer. Assess level of consciousness. As per the situation, it can be considered as the initial thing. And second, chest tube drainage attached, which is a wrong thing where you should not do that. Okay, so bed sheet should be attached, chest tube to be attached to the cot. Okay, not on the bed sheet or not on the side rails. So B is a completely wrong answer. And C, perform deep breathing and coughing exercise. That can be, but based on the current situation, it is not recommended. Why? Because the patient is not completely recovered. Apply elastic stocking to the leg. That is also an appropriate thing to prevent DVT, but that is not appropriate to the current situation. So the correct answer for this question is A.
A.
Okay. Rahmat, if you, after telling or after answering, if you keep your mic off, I'll be so happy, because in between, continuously, I have to just turn on your mic. Sorry, turn off in your mic. Okay, so next question. A community health nurse visit a patient who has suffered a stroke. The patient's spouse explained to the nurse that the patient chokes while eating sometimes. Which of the following referral order would the nurse anticipate needing for this particular patient? Okay. So the current situation, patient suffered stroke and the patient's spouse explained the nurse that the patient chokes food sometimes. And what kind of referral does this patient require, which is related with the choking? So what is choking? Choking, it is a complication of muscle paralysis or a muscle weakness that is usually expected as a result of stroke, and there are multiple other reasons also. So the basic reason for choking is muscle damage. So the muscles which are required for swallowing is a laryngeal muscle or the throat muscles. So those muscles are weak, as that can be even expected as a result of stroke. So yes, so what can be the answer? I can remove physical therapist, and even I can remove a dietitian. Okay, so dietitian and physical therapist, B and C are two wrong answer, and speech therapist and neurologist, these are the two answers remain. So which one is the correct answer, either speech therapist or neurologist? If you refer this patient to neurologist, what he will do? What he can do? What he can do, or what help he can give for this particular patient? Neurologists are necessary to assess the entire neurological system and evaluate the condition. Based on that, some kind of interventions, if patient requires to change, so that can be performed by a neurologist, or that even the order can be changed by a neurologist. But in order to prevent choking, the muscles at the throat need to be maintained stronger than the current situation. So the patient requires swallowing exercises or the throat exercises that can be performed by speech therapist. So you can refer this patient to speech therapist rather than neurologist. Clear? So what is the answer for this particular question? It is A. Anyone, any doubts? Everyone have selected neurologist, but that is not the answer. Answer is A. Okay. Next question, you can just read the question. The patient transferred to intensive care unit after craniotomy. The patient is difficult to arouse and the pupils are pinpointed non-reactive. Blood pressure is 118/70. Heart rate 58 and respiratory rate is 11. Temperature is almost okay. And which medication should the nurse prepare to administer? Adrenaline, thiamine, naloxone, and dextrose 50 mg. So here, after craniotomy, post-craniotomy, the patient is having difficulty to arouse and the pupils are pinpointed. Basically, difficulty to arouse and pinpoint pupils, that is a usual sign of morphine overload. Is there any relation between craniotomy and morphine? In this question, what medications does the current patient taking? They have not mentioned. So is there any relation between morphine and craniotomy? Yes. After craniotomy, usually for 6 hours, we normally administer morphine to reduce ICP. See, this is again a frequently asked question. After craniotomy, morphine is advised. Why? To reduce ICP. Okay, so because after surgery, the patient might be having pain and the patient's level of consciousness might be just returning. So as soon as the patient is recovering to normal conscious level, they can experience pain and they may try to mobilize their head and they may try to mobilize their body. So whatever the action or whatever the activity after immediately after surgery will give more pressure to the cranial cavity and it can cause increased ICP. So these signs are indicating side effect of morphine. So the better answer for this question is administering antidote of morphine, that is naloxone. This is very frequently asked question. So from this particular question, I can explain whatever the other question which will be asked. Number one is the antidote of morphine. And second thing, why morphine is given after craniotomy. That is the second thing. And the answer is to reduce ICP. Okay, what is the side effect of morphine? See, the first side effect that can be expected is respiratory distress. That means decreased respiratory rate. So it causes bradypnea and later on it causes respiratory arrest. Clear? And in between that, when you assess, the patient will have difficulty to arouse, and pupils are always in it's not reactive and are pinpoint. Pupils are pinpoint. Clear? So please remember this. Next question. Nurse has been assigned to care for a 60-year-old critically ill patient with a triple lumen central venous line, and the doctor's order include daily care of insertion site and a catheter device. Nurse create a care plan. Oh, sorry, there is a spelling error. Based on the nursing diagnosis. What is the nursing diagnosis? A risk for infection related to insertion of venous catheter. Which intervention is most likely to prevent infection? So what intervention is normally required to prevent infection? Yes, you can, whoever got the answer, you can just drop your answers in the chat box. Yes, yes, very good. Everyone selected. Okay, any other answer other than C? Yes, very good. Very good. So the answer is C. These kind of questions will be like frequently asked. So whenever you get this kind of word, like what measure is important to prevent infection, hand washing is the most priority interventions. Okay, very good. And next, a patient who underwent a right knee arthroplasty 2 days ago has a nursing diagnosis of impaired mobile or impaired mobility. The patient refused to get out of bed and ambulate due to chest pain. Which of the following action would the nurse most likely implement? Okay, so here what the question says, after knee arthroplasty 2 days ago. So this is the second postoperative day or third postoperative day. A nursing diagnosis has created, what is that? Impaired mobility. And why that nursing diagnosis was created? Because patient is not ready to ambulate or even get out of bed. And what the patient says, what is the reason why the patient is not mobilizing? Due to chest pain. So which action is most likely to implement at this particular moment? We'll read the option. Medicate the client prior to ambulation. See, whatever question you get like related with the chest pain, patient complained chest pain or patient is complaining chest pain, after eating patient started complaining chest pain, simply without eating the patient started complaining chest pain, during lying down patient complained chest pain, while walking patient complained chest pain, in between eating food patient complained chest pain, after taking this medicine patient started complaining chest pain, whatever that can be. Okay, so in the question, if they specifically tell chest pain can be related with a cardiac problem, or it can be related with the side effect of medication, and even that can happen as a result of pulmonary disease and gastrointestinal problem. That is, gas will also causes pain. But you have to find out what is the basic reason for this chest pain. Clear? So chest pain, basically chest pain, when we think about chest pain, so it is angina, like coronary artery disease, and MI, myocardial infarction. Even that causes chest pain. Second, pulmonary embolism, pulmonary edema, pneumonia, even that also causes chest pain. But there will be always associated symptoms. Even gas pain, that means gaseous pain after after keeping long time, fasting. So, and then immediately, see, you just skipped the morning breakfast and the lunch also, you just skipped, and now you can just imagine now it's 4 o'clock in the evening and you are really hungry and you want to eat something. So when you eat after 4 o'clock, obviously you will get immediately after eating chest pain, because the so long time the stomach was completely empty, and soon your food is entering into stomach, and it creates a particular vacuum over there, and it causes that particular air which was trapped inside the stomach will try to mobilize out, and that obviously causes chest pain, and it can be some kind of a radiating pain. But don't get confused with the cardiac thing. Okay, but whenever you just experience with any kind of chest pain with a patient, first of all, you have to find out this particular chest pain is because of what. And you need to make sure that this is not related with a cardiac problem or respiratory problem. Clear? Because cardiac problem and respiratory, basically like a pulmonary embolism and fat embolism, can be considered as an emergency situation, or it can cause, what is that called? Lethal problem, emergency problem. Clear? So the correct answer, everyone selected the correct answer, which we assess to determine the cause of chest pain. Clear? So this is something very, very important. So this kind of questions will be asked in many other way. Okay, so remember, when patient complains chest pain, first thing is you have to provide a rest and assess the reason for chest pain. Why rest is important? Because sometimes this particular pain is because of what is it? Because of cardiac problem. As soon as we give rest, the pain will start to subside, majority. Okay, so that is how you can differentiate. Okay, so the first thing is provide a rest. You have to allow the patient to lie down, or you have to allow the patient to sit in a chair, whatever. Clear? So the correct answer for this question is D. Very good. So everyone are in the normal track. Okay, next question. Prior to providing care for a hospitalized infant, the nurse focus on preventive measure. Nurse focus preventive measures. Where is the patient? So here, prior to providing for a hospitalized infant, the nurse who focus on a preventive measure. So infant is there in the hospital. So when infant is there in the hospital or admitted in the hospital, there may be chances to get infection, hospital acquired infection. What is that called as hospital acquired infection? Nosocomial infection. Very good. So what can be the answer?
B. B, ma'am.
B. Perform hand hygiene. Very good. Okay, next question. What is infant?
0 to 1 year.
0 to 1 year. Okay, very good. Next question, so I can go a bit fast. Yeah. A nurse administered a dose of morphine sulfate as prescribed to a patient who is in post-anesthesia care unit. The patient appears to be resting comfortably, and respiratory rate is 8, and saturated oxygen is on 2 liters, and the saturation is 86%. The nurse should immediately administer what? So here the patient is receiving morphine. Respiratory rate is 8, saturation is low. So this is indicating morphine side effect. So go for antidote. So the answer is C. Naloxone, or the other name is, okay, Narcan. And please tell me what is A stands for. A is also a medicine. So what is this medicine? Anyone? It's flumazenil. That is antidote of diazepam.
Benzodiazepine.
Okay, yeah, benzodiazepine, exactly. So this is antidote of A is antidote of benzodiazepine or diazepam. Clear? That is also another question. Next question. Patient is 90 minutes post-abdominal hysterectomy and complains of pain in the post-anesthesia care unit. Nurse administered the prescribed dose of intravenous morphine. 5 minutes later, the patient is difficult to arouse with the following vital signs. And what should the nurse do? Respiratory rate 6 and saturation 86. So this is also the same question. So answer is? Yes, exactly. It's morphine sulfate. Sorry, side effect of morphine, that is naloxone. You have to administer to prevent respiratory arrest and worsen, to avoid worsening of situation. Okay, so the answer is naloxone. Very good. Next, the stages of dying is identified by Dr. Elizabeth Kubler-Ross. Occurs in what order? So Elizabeth Kubler-Ross invented grief process or grieving process. Any answer?
C.
Yeah, it's C. Yeah, you can very simple way. You can just remember DABDA, DABDA. So this is how a person overcome a crisis situation. So what is the first psychological changes a person will have? It's denial. What is denial? Anyone? Those who know the answer, you can just tell me. Yes. What is denial?
Refuse to accept.
Very good. It is refuse to accept what? Refuse to accept. എന്താണ് refuse ചെയ്യുന്നത്?
Dying.
കുറച്ചുകൂടെ ഭംഗിയായിട്ട്. Not exactly dying. കുറച്ചും കൂടെ ഭംഗിയായിട്ട്. Refuse to accept truth or the current fact. മനസ്സിലായോ? Not refuse to accept dying. Exactly, it is refuse to accept whatever the exact situation. For example, a school student who just got a result where she just failed, but she was not expecting. So what is denial? She will not accept the result which is published. She will definitely tell, oh, this result can be there may be some changes, or this is a old result, or okay, she is not going to accept the current situations. That is considered as a denial. What is anchor? Everyone know what is anchor. And what is bargaining? Can anyone give any example for bargaining? Bargaining, the meaning, you know, like you are you want a particular thing, but to get that, you are just requesting someone to or you need to just make any changes to get that. Okay, so that is a kind of bargaining. Yes, so can anyone give any example for bargaining? Yes. For example, a person who is recently diagnosed with stage 3 breast cancer, first she is not going to accept her disease, first of all. So she may say that my age is not appropriate, and I have 2 kids, and I have properly breastfed the baby, and how come I get this disease? My family doesn't have any kind of this problem, and I have not been smoking and using alcohol. So why should I get breast cancer? So that will be the response by a person that is indicating denial. And after sometimes or after a day or 2 day or a week, they will move to an anchor situations. Okay, so how whoever is going to talk with the patient will not be having any patience to talk. So they will just say, like, I don't want to see you, I want to be alone, and I don't want food, I don't want medicine, all those kind of thing. And whatever the situations, if you give some kind of food also, he may just simply scold regarding the food or taste of the food and whatever thing. So that is considered as an anchor. Bargaining, it is like they may just bargain to the doctor as how can you please extend my life, and can you please cure this situation? I'm ready to adopt any kind of treatment, but I want to leave. And last they may just go to the priest and they may say like I'll give you 1 lakh rupees, and after my complete cure, I can donate my property, or I can donate something like offerings. Okay, നമ്മൾ സാധാരണ ഈ ചർച്ചിലൊക്കെ പോയിട്ട് ചെയ്യില്ലേ, നമ്മളിങ്ങനെ ഓഫറിങ്സ് ഇടൂല്ലേ, ഞാൻ ഇത് ചെയ്ത് കഴിഞ്ഞാൽ 100 മെഴുകുതിരി കത്തിക്കാം, അങ്ങനെയൊക്കെ പറയൂലേ. സോ അത് റെഗുലർ ആയിട്ട് ചെയ്യുന്നതല്ല, ചില ക്രൈസിസ് സിറ്റുവേഷനിൽ പിടി വിട്ട് നിൽക്കുന്ന സമയത്ത് നമ്മൾ ചെയ്യില്ലോ. ദാറ്റ് ഇസ് കൺസിഡേർഡ് എസ് എ ബാർഗൈനിങ്. ഫൈൻ. So bargaining, it is giving offer to someone to get something. Okay, so basically we give offer not to the person, only we give offer to the God, as per my experience. That is a quite normal thing. And next is a depression. So after going through denial, anchor and bargaining, still there is no hope. Obviously their entire hope will reduce and they may move to depression. And last is acceptance. Anyway, there is no other point. Some person will stand in depression, but some may overcome depression and they may move to acceptance. And last, they may accept the problem. Okay, so and then they will act appropriately. Okay, so this is how a person should go. Okay, and what is an abnormality? When a person who is recently diagnosed with a stage 3 breast cancer, suddenly she is telling that, yeah, I am accepted, I know. So this is quite normal thing. I know what is the treatment and I'm not going to receive any kind of treatment. See, this is not at all good. She or he is moving to an abnormal, what is that, grieving process, where she can get up with any other problems. Okay, so normal a person should move through these phases, and the phases should be even in this particular manner. Clear? So please remember this, and you may get questions related with the bargaining. Sometimes they give some kind of situation or example, and they may ask like this particular example is belong to which process of grieving. Okay, so it is considered as a grief process, or sometimes it can be considered as a process of dying. Clear? And who invented this? Dr. Elizabeth Kubler-Ross. You can very simply remember DABDA, D-A-B-D-A, and that is a proper order. Next question. So whatever extra rationales I'm explaining, I want everyone to write in your notebook, so that always will help you to score good marks and solve the correct answer for other questions. 42-year-old patient is in lower body cast following a motor vehicle accident. In order to minimize the muscle strength loss while in the cast, the nurse will instruct the patient in performance. See, the specific thing that you need to remember, I'll just underline that. Patient is in lower body cast, where the cast is in place in order to minimize the muscle strength. Okay, in order to minimize the muscle strength loss, exercise. So what the person should perform. So what is the situation? Cast is in place, and what can be the complication of cast? One of the complication is decreasing muscle strength, because that muscle is not been using at least for 2 weeks or 4 weeks. So when whatever muscles we are not using, obviously that muscle strength will gradually reduce. So you have to use your muscles. Okay. So as we start to use, the strength will increase. Fine. So a person who has a cast in place, obviously there is a side effect, that is decreasing muscle strength. So in order to prevent that, you can perform some kind of exercise. So what exercise is important? Yes. Okay. So there are different answers. Okay. So I'm really happy that no one have selected B and D. So very safely we can remove B and D. So no one is agreeing with the B second one and fourth one. Okay, that is wrong. Okay, so I'm happy. Passive range of motion exercise is removed, and a resistive range of motion exercise. What is resistive range of motion exercise? It is a kind of counter pressure. So suppose a person who is starting to mobilize his head, and whoever is supporting, he is like providing opposite pressure. For example, how do we perform punching ചെയ്യില്ലേ? What is it called? അങ്ങനല്ലേ പറയാ, പഞ്ചി രണ്ടാള് രണ്ട് സൈഡിൽ വന്നിട്ട് കൈ വെച്ചിട്ട് ഒരു കൗണ്ടർ പ്രഷർ ഇട്ടിട്ട് നമ്മൾ പഞ്ച് ചെയ്യത്തില്ലേ? സോ അതൊക്കെ ഒരു റെസിസ്റ്റീവ് കൈൻഡ് ഓഫ് എക്സസൈസ്. ആൻഡ് സി റെസിസ്റ്റീവ് കൈൻഡ് ഓഫ് എക്സസൈസ് യൂഷ്വലി വി പെർഫോം ഇൻ ജിം, lifting some particular weight and lifting against gravity force. Okay, so that always helping to make the muscle strong and stronger, but that is not recommended for any kind of patients. Okay, so D is wrong and second one is wrong. And now we got two answers: isometric exercise and active assistive range of motion exercise. What is active assistive range of motion exercise? So please remember what is active range of motion exercise and what is passive range of motion exercise. Active range of motion exercise is a kind of exercise that is performed by the patient itself by or under the verbal order. For example, when you say patient is doing, lift your hand. So patient is lifting, flex your hand. Patient is flexing. So simply following all verbal commands and doing is considered as an active range of motion exercise. What is passive range of motion exercise? That is, the patient is not able to perform any kind of activity based on the order, like or the guidance. He doesn't have the muscle strength. So if he wanted to move his leg or hand, he requires someone's help. Okay, so with the help of someone, doing exercise is considered as a passive range of motion exercise. Okay, active range of motion exercise is patient is able to mobilize his or her hand, but in order to complete that activity, he or she requires someone's help. That is considered as active assistive range of motion exercise. So you have to be very clear that what is passive range of motion, passive range of motion, active range of motion, active assistive range of motion, and resistive range of motion. All these four exercise. Okay, resistive range of motion is not going to give any for any of patients, so you can completely remove D. Active assistive range of motions can be given a person who has some muscle strength and doesn't have the completing. So in those situations, active assistive range of motion can be given. And passive range of motion is given for a patient completely paralyzed, where patient himself is not able to mobilize any kind of activities. And what is isometric kind of exercise? Isometric kind of exercise is the better exercise that is usually given for this particular patient. Okay, so it's very good one. And whereas here you are just strengthening or contracting the muscles. Okay, and where there may not be any visible movement outside, it's like a muscle contraction. Okay, so I can very simply give you an example that if I ask you all to hold the breath, or if I ask all of you to just hold your tummy inside. Okay, So there won't be any motion visibly outside, but you are holding your tummy inside. Okay, how long you can hold your tummy inside? So in order to keep your tummy inside, you have to just take the breath and just hold it. Okay, so that kind of exercise is considered as an isometric exercise. For this particular group, you have to give isometric exercise. Okay, I just wanted to give another question, and the question, please remember, the question is, instead of the first